my name's Jeremy Rawlins. I'm a consultant plastic surgeon working here in the UK but also in Australia and other parts of the world as well. Predominantly the work that I'm doing here involves scar revision and really looking at patients in a very individualised way in terms of what their scar related problem might be. Is it traumatic scarring? Is it scarring associated with acne? Is it pigmentation issues associated with scarring, or even pigmentation or skin related conditions associated with just getting older or sun damage? The sorts of treatments that I offer here at Zenith include really the full spectrum of scar revision and aesthetic treatments, but one of the things that I particularly have found very useful in my practice has been using RECELL, so non-cultured autologous skin cells to really complement wound healing in scar revision. So what they can expect is obviously an understanding of their problem, because each patient's problems are unique, and that's really what is exciting and interesting about being a plastic surgeon, that there's no one solution to everyone's problem. It's a case of very individualised care, deciding what we need to do in terms of wound bed preparation, whether that uses laser, whether it's dermabrasion, whether it's a needling device, and then thinking about whether we're going to use RECELL or indeed another treatment. And they'll get from me a good understanding as to the problem they've got and the various tools in which we're going to use to try and resolve that problem for them, or improve their scarring or their skin or whatever it is that they need to have improved. Certainly, bring all your questions, because there's never a silly question. The more empowered a patient is in terms of their questions being answered, I think their expectations are realistic, and they can go into their procedure knowing what the outcomes are likely to be, and certainly be prepared for what will hopefully be a good outcome and resolution to their scar related problem. Patients and I have to have a very realistic expectation as to what we're trying to achieve, and if it's unlikely to be improved by whatever technique that we may have, then it's foolish to embark on any sort of surgery, not to mention aesthetic or plastic surgery, without a good understanding or a likely good improvement.